Daily milk production reaches a maximal value at some point after lactation begins, and then gradually declines over time in most species. The decline in milk production is associated by a gradual decrease in the number of active alveoli and an increase in the relative amount of connective tissue. Mammary gland involution is the term describing the conversion of milk-secreting gland with milk-filled alveoli to one characterized by small, non-secreting alveoli surrounded by an extensive amount of connective tissue. Mammary involution can be stimulated at any stage of lactation by the removal of suckling young or in dairy animals by suspending milking. Most of the detailed cellular and molecular research on mammary involution has focused on effects of acute induction of involution. However, after the peak of lactation, a gradual involution occurs as the young progressively wean. In dairy cows, there is also a gradual decline in milk production with time, even with regular milking. This decline is greater for cows that become pregnant soon after calving. Involution is characterized by apoptosis of the lactational mammary epithelium after lactation has ceased. During involution, immune cells such as lymphocytes and macrophages invade the mammary tissue. There is also extensive cell death, which results in the detachment of dying cells into the alveolar lumen. It primarily involves the wearing away of the secretory epithelial layer and adipose tissue or fat layer, consequently replacing it. There is a tissue remodeling and redifferentiation of adipocytes associated with the second wave of cell death that returns the gland to a near pre-pregnant state. Consequently, there is a buildup of pressure within the mammary gland, causing the secretory cells to become less and less functional. This phenomenon is called the pressure atrophy. Pressure atrophy is such a powerful force that milk synthesis can be stopped within just a few days if the intermammary pressure is allowed to build up suddenly. The milk synthesis occurring in the alveolar epithelium decreases to the point that cells undergo almost complete atrophy. Cells will remain non-functional until the subsequent pregnancy.